Projected 50% reduction in radiation side effects across healthcare, aerospace, and military sectors by Q2 2025. Overview. Recent projections indicate a groundbreaking advancement in radiation technology that is expected to lead to a 50% reduction in radiation side effects across healthcare, aerospace, and military sectors by the second quarter of 2025. This remarkable reduction in radiation exposure is anticipated to enhance treatment efficacy and safety, potentially transforming practices in radiation therapy, aviation safety protocols, and military operations. Key developments across sectors. 1. Healthcare. The healthcare sector is witnessing significant innovations in radiation oncology that are pivotal to achieving this reduction in side effects. Key developments include precision radiotherapy. Advanced techniques such as intensity-modulated radiation therapy (IMRT) and stereotactic body radiotherapy (SBRT) are being refined to better target tumors while sparing surrounding healthy tissue. This precision not only minimizes side effects but also enhances the overall effectiveness of cancer treatments. Advanced imaging systems. New imaging technologies, including MRI and PET scans, are being integrated with radiation therapy to provide real-time feedback on tumor response, allowing for more adaptive treatment plans that can be adjusted based on patient needs. Patient-centric approaches. There is a growing focus on personalized medicine where treatments are tailored to individual genetic profiles, helping to predict and mitigate potential side effects before they occur. 2. Aerospace. In the aerospace sector, significant investments are being made to improve safety against cosmic radiation, particularly for long-duration flights and space missions. Key initiatives include improved shielding. Research into new composite materials that offer better radiation protection without adding significant weight is underway. These materials are essential for the design of both commercial aircraft and spacecraft. Real-time monitoring technologies. The development of sophisticated monitoring systems allows for continuous tracking of radiation exposure levels during flights. This data can be used to inform safety protocols and protect crew and passengers from harmful radiation. 3. Military applications. The military sector is also focused on reducing radiation exposure for personnel, particularly in combat zones and during operations involving nuclear materials. Key strategies include enhanced protective gear. The development of advanced protective clothing and equipment designed to shield soldiers from ionizing radiation is a priority. Ensuring their safety during operations that may involve radiation exposure. Radiation detection systems. Improved detection technologies are being developed for real-time monitoring of radiation levels in the field, enabling military personnel to make informed decisions and take action to minimize exposure. Common key points. Across all sectors, several common themes have emerged that contribute to the projected reduction in radiation side effects. Interdisciplinary collaboration. There is a notable trend toward collaboration among healthcare professionals, aerospace engineers, and military strategists. By sharing insights and expertise, these sectors can develop comprehensive solutions to address radiation exposure issues effectively. Technology integration. The incorporation of artificial intelligence (AI) and machine learning into radiation management systems is becoming increasingly prevalent. These technologies enable the analysis of vast amounts of data, predicting potential exposure scenarios and optimizing protective measures accordingly. Regulatory support. As advancements in radiation technology progress, there is a growing acknowledgement of the need for supportive regulatory frameworks. In healthcare, for instance, evolving payment models are being discussed to accommodate new treatment modalities and ensure that innovations can be widely implemented. Differences between sources. While most sources emphasize the technological advancements driving this projected reduction, some also highlight the economic implications. For example, the healthcare sector faces potential payment cuts that could impact the adoption of new technologies. Conversely, the aerospace and military sectors focus more on the strategic advantages of reduced radiation exposure, recognizing that improved safety can enhance operational effectiveness. Timeline of events: 2023, initial research and development efforts commence across healthcare, aerospace, and military sectors with a focus on reducing radiation side effects. Late 2023, preliminary studies yield promising results in radiation therapy techniques and material science innovations for aerospace applications. 2024, significant investments are made in technology development, and collaborative pilot projects are launched across sectors. Regulatory discussions begin regarding the approval of new treatments and technologies. Q1 2025, completion of trials and validation of new technologies is expected, leading to broader implementation strategies across all sectors. Q2 2025, the anticipated 50% reduction in radiation side effects is projected to be realized with widespread adoption of new practices and technologies across healthcare, aerospace, and military sectors. Conclusion: the projected advancements in radiation technology by mid-2025 hold great promise for significant improvements in safety and efficacy across multiple sectors. As stakeholders continue to collaborate and innovate, the reduction of radiation side effects can redefine global standards of practice, leading to enhanced patient care, safer air travel, and improved military operations. The collective efforts across healthcare, aerospace, and military sectors signify a pivotal moment in the ongoing quest to mitigate the risks associated with radiation exposure. The projected 50% reduction in radiation side effects across healthcare, aerospace, and military sectors by Q2 2025 presents several counterintuitive insights that challenge conventional understanding of radiation exposure and its management. 1. Healthcare innovations versus economic constraints. While advancements in precision radiotherapy and imaging technologies promise improved patient outcomes, there is an ironic twist. The healthcare sector is simultaneously facing potential payment cuts that could hinder the adoption of these very innovations. This indicates that even with technological progress, economic pressures can stifle implementation, suggesting that financial viability may take precedence over clinical advancement in some scenarios. 2. Interdisciplinary collaboration and diverging objectives. The trend towards interdisciplinary collaboration is notable, yet it raises an unexpected complexity. While healthcare professionals, aerospace engineers, and military strategists are joining forces to tackle radiation exposure, their primary goals may differ significantly. For instance, healthcare focuses on patient outcomes, aerospace on safety and efficiency, and military on operational effectiveness. This divergence could lead to conflicting priorities in research and development, challenging the cohesiveness of collaborative efforts. 3. Technological integration and potential over-reliance. The integration of artificial intelligence and machine learning in radiation management systems is a double-edged sword. While these technologies enhance data analysis and predictive capabilities, there is a concerning potential for over-reliance. If decision-making becomes too dependent on AI, it may lead to complacency among professionals who might neglect the essential human oversight necessary in critical situations, particularly in healthcare where patient lives are at stake. For regulatory frameworks and innovation stifling. The anticipated need for regulatory frameworks to support advancements in radiation technology could paradoxically become a barrier to innovation. As new treatment modalities emerge, the regulatory process may lag, causing a bottleneck that delays the rollout of beneficial technologies. This creates a scenario where the very regulations designed to ensure safety could inadvertently impede progress. 5. Material science advances versus practical implementation. The aerospace sector's development of new composite materials for radiation shielding illustrates a counterintuitive dynamic. While these materials may offer weight reductions and enhanced protection, their practical implementation in existing aircraft and spacecraft may face logistical challenges. The cost of retrofitting older models and the time required for certification processes could delay the benefits of these innovations, suggesting that technological progress does not always translate into immediate operational improvements. 6. Military focus on radiation detection. The military's emphasis on enhanced radiation detection systems, while crucial for real-time monitoring, may inadvertently lead to a perception that the risk of radiation exposure can be entirely mitigated. This could result in complacency regarding safety protocols, as personnel might rely heavily on technology rather than maintaining rigorous safety measures. This paradox of increased reliance on technology potentially undermining safety awareness is critical to address. 7. Cosmic radiation in aerospace versus ground-based concerns. The aerospace industry's focus on cosmic radiation presents a surprising contrast to ground-based concerns about radiation exposure. While advancements in shielding may significantly improve safety for air travel, they may lead to an underappreciation of radiation risks in other contexts such as medical imaging or nuclear power generation. This could shift attention away from addressing terrestrial radiation issues, creating an imbalanced approach to radiation safety. 8. Public perception of radiation risks. As awareness grows regarding the reduction of radiation side effects, public perception may shift in unexpected ways. There is a risk that the announcement of a projected reduction could lead to complacency among patients and professionals alike, diminishing the perceived need for caution in radiation use. This counterintuitive outcome highlights the importance of maintaining a balanced discourse around radiation safety even in light of positive advancements. Overall, the projected advancements in radiation technology and the anticipated reduction in side effects present a complex landscape. While the promise of improved safety and efficacy is clear, these counterintuitive insights reveal that the path to achieving these goals is fraught with challenges that must be navigated thoughtfully. The interplay of technology, economics, regulatory frameworks, and human behavior will ultimately shape the success of these initiatives across healthcare, aerospace, and military sectors. Important content in the report and its significance. The report projects a 50% reduction in radiation side effects across healthcare, aerospace, and military sectors by Q2 2025, highlighting significant advancements in radiation technology. While the overarching themes of technological innovation and interdisciplinary collaboration are prominent, several critical points may be overlooked, each carrying substantial implications for the future. 1. Interdisciplinary collaboration. Significance. The report mentions a growing trend in interdisciplinary collaboration as professionals from healthcare, aerospace, and military sectors work together to address radiation exposure. This collaboration is pivotal because it fosters innovation that transcends traditional silos, allowing for a holistic approach to problem solving. Many people may overlook the importance of this collaboration, assuming advancements will arise from isolated efforts within each sector. However, the convergence of knowledge and expertise from diverse fields can lead to groundbreaking solutions that none of the sectors could achieve independently. For instance, techniques developed in radiation oncology may inform protective measures in aerospace, while military strategies could enhance safety protocols in healthcare environments. 2. Economic implications and regulatory support. Significance. The report briefly touches on the economic implications of technological advancements, particularly in the healthcare sector, where payment cuts could hinder the implementation of new technologies. This aspect is crucial because it illustrates the tension between innovation and financial sustainability. Without proper regulatory support and funding structures, even the most promising advancements may fail to reach widespread adoption. The lack of attention to economic factors can lead to an overestimation of how quickly and effectively new technologies can be integrated into practice. Stakeholders must advocate for regulatory frameworks that not only support innovation but also ensure that these advancements are financially viable for healthcare providers. 3. Technological integration of AI in machine learning. Significance. The integration of artificial intelligence (AI) and machine learning into radiation management systems is a common theme in the report. While some may recognize the novelty of these technologies, the profound impact they can have on optimizing radiation exposure scenarios is often underestimated. AI can analyze vast amounts of data to predict radiation exposure risks and enhance protective measures. This capability is particularly significant in high-stakes environments like healthcare and military operations where real-time decision-making can save lives. Neglecting the transformative potential of AI in this context risks underappreciating how technology can fundamentally reshape safety protocols and treatment efficacy. 4. Materials science innovations in aerospace. Significance. The report highlights advancements in materials science for improved shielding in aerospace but may downplay the broader implications of these innovations. New composite materials that provide better radiation protection with less weight are not just beneficial for aerospace safety, they can also have far-reaching applications in other fields including construction and environmental protection. By improving material properties, industries can create safer work environments and develop more sustainable products. This interconnectedness of advancements across sectors illustrates the potential for cross-industry applications which can lead to unexpected benefits and efficiencies. 5. Timeline of implementation and its challenges. Significance. The timeline outlined in the report suggests a rapid progression from research and development to implementation by Q2 2025. However, this optimistic outlook may overlook the inherent challenges in technology adoption, such as regulatory hurdles, training for healthcare professionals, and the need for public trust in new methods. Understanding that timelines in technology adoption can be unpredictable is crucial for stakeholders. Anticipating potential delays and challenges can lead to more robust planning and resource allocation. Stakeholders should prepare for possible setbacks to ensure that advancements do not stall due to unforeseen complications in the implementation process. 6. Potential global standards redefined. Significance. The report concludes by mentioning that the reduction of radiation side effects could redefine global standards of practice. This point, while significant, may not receive the attention it deserves. The establishment of new standards can lead to widespread changes in protocols, training, and policy across multiple sectors. The ability to set new benchmarks for safety and efficacy can facilitate international collaboration and improve global health outcomes. However, the process of establishing these standards can be complex and contentious as it requires consensus among various stakeholders, including governments, regulatory bodies, and industry leaders. Conclusion. The projected advancements in radiation technology by mid-2025 present a transformative opportunity across healthcare, aerospace, and military sectors. However, the significance of certain aspects, such as interdisciplinary collaboration, economic implications, technological integration, material science innovations, implementation challenges, and the potential for redefining global standards, should not be overlooked. Recognizing these factors is essential for stakeholders to navigate the complexities of innovation and ensure that the promise of reduced radiation side effects is fully realized. 1. Advancements in radiation oncology. The healthcare sector is poised for transformative changes due to innovations in radiation oncology. Techniques such as precision radiotherapy and advanced imaging systems aim to minimize collateral damage to healthy tissues while maintaining effective tumor targeting. This not only enhances treatment efficacy but also significantly shortens recovery times for patients. A deeper analysis of these technologies can reveal how they contribute to improved patient outcomes and potentially reshape standard practices in oncology. 2. Materials science innovations in aerospace. The aerospace industry's investment in new composite materials and enhanced shielding technologies is crucial for protecting against cosmic radiation. Lightweight materials that offer better protection are essential for modern aircraft and spacecraft design. An in-depth discussion could explore the implications of these advancements on aircraft design, the safety of space missions, and how they could influence regulatory standards in aerospace safety. 3. Military radiation safety enhancements. The military's focus on reducing radiation exposure through better protective gear and advanced radiation detection systems is vital for personnel safety in combat and nuclear operations. Examining the strategies being implemented, including real-time monitoring and improved training for personnel, can highlight the importance of integrating technology into military operations and how these practices might be adopted in civilian sectors. For interdisciplinary collaboration and regulatory support, the trend of interdisciplinary collaboration across healthcare, aerospace, and military sectors is a significant point of analysis. By sharing insights and developing comprehensive solutions, these sectors can address radiation exposure more effectively. Additionally, the role of regulatory frameworks in supporting technological advancements cannot be overlooked. An analysis of how evolving payment models in healthcare and strategic benefits recognized by the military and aerospace sectors can shape the future of radiation management will be essential to understanding the broader impact of these advancements. Here are 3 famous historical cases that resonate with the projected advancements in radiation technology and its impact across various sectors. 1. The Manhattan Project, 1942 to 1946. The Manhattan Project was a pivotal research and development project during World War II that produced the first nuclear weapons. This effort brought together scientists, engineers, and military personnel to develop atomic bombs, culminating in the bombings of Hiroshima and Nagasaki. The project illustrated the tremendous potential and dangers of nuclear technology, leading to significant advancements in understanding radiation. Post-war, the lessons learned from the Manhattan Project influenced both military and medical applications of radiation, including the development of radiation therapy for cancer treatment. The legacy of the Manhattan Project continues to shape discussions on radiation safety, technology, and ethics. 2. The Chernobyl disaster, 1986. The Chernobyl nuclear disaster in Ukraine was one of the worst nuclear accidents in history, resulting from a reactor explosion that released large quantities of radioactive particles into the atmosphere. The immediate and long-term health effects of radiation exposure were devastating, leading to acute radiation syndrome, thyroid cancers, and psychological impacts among affected populations. This catastrophe underscored the critical need for improved safety protocols and technologies in nuclear operations, influencing regulations and advancements in radiation protection. In response, the nuclear industry and healthcare sectors have worked to enhance safety measures, develop better radiation monitoring systems, and improve treatments for radiation exposure, reflecting the ongoing evolution of radiation management. 3. The Hiroshima and Nagasaki bombings, 1945. The atomic bombings of Hiroshima and Nagasaki by the United States resulted in unprecedented levels of radiation exposure to the civilian population. The immediate destruction and subsequent health effects, including radiation sickness and increased cancer rates, highlighted the severe consequences of radiation exposure. In the aftermath, extensive studies were conducted to understand the effects of radiation on human health, leading to significant advancements in radiation safety and medical treatment. This historical event catalyzed global discourse on nuclear weapons, radiation safety, and the ethical implications of radiation use in warfare and medicine. The legacy of these bombings continues to inform current practices in radiation therapy and protective measures in healthcare, military, and aerospace sectors. These cases exemplify the historical context surrounding radiation technology and its multifaceted impacts, echoing the anticipated advancements and reductions in radiation side effects projected for the future. Future outlook: projected 50% reduction in radiation side effects by Q2 2025. As we look ahead to Q2 2025, the projected 50% reduction in radiation side effects across healthcare, aerospace, and military sectors signals a transformative era driven by technological innovation and interdisciplinary collaboration. This forecast is built on the foundation of significant advancements already underway and highlights the potential for a paradigm shift in how radiation exposure is managed and mitigated. Healthcare innovations. In the healthcare sector, the focus on precision radiotherapy is likely to yield remarkable improvements in cancer treatment outcomes. Emerging technologies such as adaptive radiotherapy, which tailors treatment plans based on real-time imaging, will minimize damage to surrounding healthy tissues. Furthermore, the integration of artificial intelligence (AI) in treatment planning and delivery is expected to enhance accuracy and efficiency, leading to fewer side effects and shorter recovery times for patients. By 2025, we can anticipate not only a decline in adverse effects from radiation therapies but also a broader acceptance of these innovative approaches. The potential resistance due to payment cuts in radiation oncology may be countered by the demonstrable benefits of improved patient outcomes, persuading healthcare payers to adapt their reimbursement models. Aerospace safety enhancements. The aerospace industry is poised to undergo significant changes with the implementation of advanced materials and shielding technologies. Research into lightweight composites that can effectively shield against cosmic radiation is accelerating, driven by the growing recognition of the risks posed to long-duration space missions and high-altitude flights. By mid-2025, we can expect that airlines and space agencies will adopt these innovations, thereby enhancing passenger safety and crew health. The adoption of real-time radiation monitoring systems will also become standard practice, allowing for proactive measures to be taken during flights, further reducing exposure risks. Military applications and protective measures. In military applications, emphasis on radiation safety for personnel in combat scenarios will lead to enhanced protective gear and improved operational protocols. The integration of advanced detection systems will enable real-time monitoring of radiation levels, allowing military strategists to make informed decisions in environments where nuclear materials are present. By Q2 2025, we can foresee a more comprehensive approach to radiation safety within military operations, likely resulting in fewer health complications for service members and increased mission effectiveness. Additionally, the military's focus on research and development could spark further innovations that spill over into civilian applications. Interdisciplinary collaboration and regulatory support. The collaborative efforts among healthcare professionals, aerospace engineers, and military personnel will likely result in cross-sector innovations that address radiation exposure comprehensively. This interdisciplinary approach is expected to create a more robust framework for managing radiation risks, drawing from the best practices and technologies across fields. Moreover, regulatory bodies will play a critical role in supporting these advancements. By 2025, we anticipate the establishment of new guidelines that facilitate the adoption of innovative technologies while ensuring safety and efficacy. This regulatory support will be crucial in transforming theoretical advancements into practical applications. Economic implications and future challenges. While the potential benefits of reduced radiation side effects are clear, economic challenges remain. The healthcare sector may continue to face pressures from payment cuts affecting the pace of technology adoption. However, the demonstrated effectiveness of new treatment modalities could drive changes in reimbursement policies, ultimately benefiting patients and providers alike. The aerospace and military sectors are likely to experience a different set of challenges, including budget constraints and the need for sustained investment in research and development. Addressing these financial hurdles will be essential to ensure that innovations can be fully realized and implemented. Conclusion. The future outlook for the projected 50% reduction in radiation side effects by Q2 2025 is optimistic, underpinned by technological advancements, interdisciplinary collaboration, and evolving regulatory frameworks. As the healthcare, aerospace, and military sectors continue to innovate and share insights, we can anticipate significant improvements in safety and efficacy. This transformation will not only redefine standards of practice but also enhance the quality of life for individuals exposed to radiation in various contexts. By mid-2025, the collective efforts across these sectors may very well herald a new era of radiation safety and management, setting a precedent for future advancements in health and technology.